Welcome to The Explainer. Today, we're going to break down one of the most effective forms of permanent contraception out there, the vasectomy. So, check this out. Every single year in the US, about 500,000 people opt for a vasectomy, and lately that number has been absolutely surging. I mean, listen to this quote from urologist Dr. Justin Human. He saw a 300% weekly increase after a major legal decision. So, what is this procedure that's suddenly getting so much attention? Okay, so let's get right into it. You might have this, old school picture in your head of what a vasectomy is. But the modern procedure, it's way, way simpler and less invasive than you probably think. Yeah, the gold standard today is the no scalpel vasectomy, or NSV for short. And the name kind of says it all, right? Instead of a scalpel and an incision, the doctor uses a special tool to make one tiny little puncture. The whole point is to reduce recovery time and the chance of complications. It's actually a pretty straightforward process. You can boil it down to just 3 steps. First, they numb the area, of course. Then comes that single small puncture. And finally, the doctor locates the tubes that carry sperm, the vas deferens, and seals them up. That's pretty much it. And when you put it side by side with the old school method, the benefits are just super clear. The conventional way used a scalpel, but this puncture method means a lower risk of bleeding, bruising, infection, you name it. Plus, it's faster. All right, so it's safer, it's quicker, but wow, there are still so many myths floating around out there. So let's just go ahead and bust the 5 biggest ones, shall we? Okay, this is probably the biggest one. The question on everyone's mind. Is it going to change how sex feels? The short answer? Absolutely not. It's a total myth. See, the procedure doesn't go anywhere near the nerves that handle pleasure and sensitivity. And you know what's interesting? A lot of people actually say sex gets better afterwards because that whole worry about an unplanned pregnancy is just gone. All right, myth number 2. What about your hormones? Is this thing going to mess with your testosterone? Nope, 100% false. There's absolutely zero evidence for this. A vasectomy just stops sperm from getting out. It has nothing to do with how your body produces hormones. Okay, let's tackle another major worry, erectile dysfunction. Can a vasectomy cause it? And again, the answer is a hard no. Medically, they're not even related. Erections are all about blood flow. A vasectomy works on the vas deferens tubes. They're in completely different zip codes. Anatomically speaking, there's no impact whatsoever. This next one kind of makes sense on the surface. If you're blocking the sperm, doesn't that mean there's, less stuff coming out? Well, take a look at this. The reason it's a myth is because sperm itself makes up a teeny tiny fraction of the total volume. We're talking like 1%. The other 99% comes from other glands that aren't touched at all, so you would literally never notice the difference. And for our last myth, this is a serious one. What about the long term? Is there any link between getting a vasectomy and prostate cancer? Look, all the big medical organizations, like the American Urological Association, have studied this again and again and again, and the verdict is in. There is no causal link, period. It's considered a very safe procedure with no connection to cancer. Okay, so we've cleared the air on some of those myths. Now, let's get down to the nitty-gritty. What's recovery actually like? The good news is it's usually super quick and really predictable. Those first 48 hours are key. That's your time to just chill, lie down, use some ice packs. After that, by day 3 or so, you're back to light stuff, and in just a few weeks, you're pretty much back to 100%. Okay, so here are the big do's and don'ts for recovery, but I want to call out that last one because it is absolutely the most critical piece of advice. Do not assume you are sterile immediately after the procedure. You're not. And that's because there are still some swimmers left upstream, so to speak. They need to be cleared out of the system, which leads us to the final non-negotiable step in this whole process. You are not in the clear, you are not sterile until a lab test gives you the green light. It's called a post-vasectomy semen analysis. Basically, they're looking under a microscope to confirm there are either 0 sperm or just a tiny amount that can't move. And while the exact timing for that test might vary a little bit depending on where you are in the world, the US versus the UK, the goal and the criteria for success, they're pretty much the same everywhere. You gotta wait a few months and then get that test. And really, it all comes back to what Dr. Hellman was saying. A lot of the conversation around vasectomies is about shared responsibility. It's safe, it's simple, and it's incredibly effective. So it really makes you think, what's the biggest barrier that keeps more people from choosing this option?